Curtis is just 6 years old, and doctors have said he'll be dead by the time he's 12, if not sooner. His brain cells are slowly dying, and with them so is he. His body is systematically shutting down. What started out as being clumsy developed into seizures, and now he's almost blind. He can no longer speak, all because of a rare neurological disorder known as Batten disease.
There's no cure at all. What we're trying to do here is, stop the disease or stop the progression or at least slow it down and hope that maybe a year or two down the road there might be a cure.
Try and buy time.
Yes, and improve his quality of life.
Curtis and his mum Donna have come a long way for a little hope. From their home in Philadelphia to this hospital in Beijing, which specializes in stem cell treatment, the kind of treatment which is not available in the US. The doctors here say they've treated about 100 foreigners who pay up to $40,000 for what many believe might just be their last chance. Wu Lika is the head of neurology.
The patients we meet here in our hospital basically carry severe symptoms. They are normally in the last period and just take a final shot to see if the stem cells work.
Doctors here use neural stem cells harvested from babies who've died within a few weeks after they're born. Curtis received 4 separate injections directly into his spine. Donna was told not to expect too much, but after the very first injection...
He hasn't spoken a word in 3 or 4 months, and the last thing he said was the word you. We would say I, love, and then he would say you. And that was after his first injection. I was laying here with him, and I tried it, and he said it, and we were just astounded.
She says Curtis was able to hold up his head, was smiling and laughing again.
Oh, God. I started crying right away. Tears of joy, of course, and we could only get him to do it one more time after that, but it gave me back a lot of hope that I was losing.
After that first treatment, Curtis developed an infection, and the next 3 injections never produced the same results. But Donna is convinced there are signs of improvement and reason to hope.
There are the risks involved, but I would do anything to, try to help him.
Looking for a miracle in a way?
Hoping for a miracle. He deserves it.
Despite what appear to be encouraging results, critics, especially in the United States, say hospitals like this one in China are simply offering false hope. The doctors here admit they've never conducted standard clinical trials on the treatment they're giving Curtis. They refuse to share with us the science behind those injections. Their findings have never been published in any known medical journal. They've never been subject to peer reviews. And while officials here say they're in contact with Harvard University, no one at Harvard could confirm that. But the doctors here deny they're preying on the vulnerable, sick and desperate, saying they never promise a cure.
They hope a cure, but I can say for those kind of disease, cure is very difficult to target or objective. But at least we bring hope to them. Some people, the disease got stabilized, which is really, really encouraging.
After returning home, Curtis's physical therapist says he's shown improvement, better control of his neck and trunk, and so Donna is planning a return trip for another round of stem cell injections, convinced it's doing something to help. John Vors, CNN Beijing.